So, an introduction to monosynaptic reflexes. So, a monosynaptic reflex is also known as a stretch reflex. So, it's just a muscular movement. And just as the name states, it's monosynaptic. So, there is only one synapse between the sensory and motor neuron that is involved. And then the stimulus is usually a sudden stretching of the muscle. And then the receptor is a muscle spindle, which has already been discussed. And then the motor command is, of course, just contraction of the muscle, which will prevent you from falling. And we can go on to the next slide. Thank you. So I won't go into too much detail as Louisa and Jordan just covered this topic, but the muscle spindle itself is a stretch receptor located in many skeletal muscles, as mentioned, and they supply proprioceptive info for control of muscle tone, posture, coordinated movement, and corrective reflexes, just to name a few. And as you can see here on the bottom left photo, as an action potential frequency increases, the muscle is stretched, and then right next to it, when the action potential frequency declines, there is contraction. And then here on the right side is also, just quickly, this is a close-up image of what a muscle spindle looks like. And as Arissa already mentioned about the reflex arc as well, there are only 5 basic components, and we're just covering this so you know how it works. So the same 5 apply. So receptors, so here it's just showing the skin is the receptor. And then also we have the sensory neuron in blue, and then the integration center in green, and then the motor neuron in red or pink, and then the effector being the muscle. And so the most common monosynaptic reflex is the patellar stretch reflex or knee jerk reflex, which is another name that you may know it as. We've all been to the doctors before, and we had the doctor have us sit down, put our feet on the ground, or either have one of our legs crossed on top of our thigh, and then used a reflex hammer. So the way that works is the sudden kicking movement of the lower leg is in response to, of course, the tap from the reflex hammer, and that's done at the patellar tendon, which is right below the knee, as depicted here in the photo. And the sharp tap on the tendon slightly stretches your quads. And then in reaction, these muscles contract, and the contraction tends to straighten the leg in a kicking motion, so it makes you kick outward. And exaggeration or absence of the reaction usually suggests that there may be damage to the central nervous system. And it can also be helpful in recognizing thyroid disease. And another reflex is also the biceps and tricep reflex. So works similarly, except the tendons here will be in between the olecranon and then the antecubital area. And of course, this is going to focus on the major motor reflexes of the upper limb. And then this test is used to strengthen the reflex and can aid in localizing a patient's weakness to the upper motor or lower motor neurons. And then next here, I just have the pathway of both of the reflexes together so you can see how they look instead of being separate. This is just a diagram that shows you them together. Same steps as the simple reflex arc, but as you can see, both tests can be done, and they're both to make sure that there isn't any damage to the central nervous system. Excuse me. And next, Karla will just be talking about how these reflexes are graded to start off with.
So these reflexes are graded on a scale from 0 to 4. 0 is absent, 2 is normal, and 4 indicates hyperactivity, wherein like the tap elicits a repeating reflex. And grading these reflexes is important because it helps like doctors realize that there's abnormalities that can often indicate that the reflex arc has been affected, and it could involve a lot of different other problems. So when testing these reflexes, it's important to know, for the doctor to know what spinal root level they are testing, and that spinal root level chart or table is on the right. If a reflex is not present, it could be due to a problem with the receptor, the spinal cord, the motor neuron, or the neuromuscular junction itself, or the muscle. And it's also important for them to look for a hyporeflexia or a hyporeflexia. And if a lesion involves the anterior horn of the spinal cord, or it's at the level of the motor fiber itself, then it would be defined as a lower motor neuron lesion, which is LMN. And these lesions result in a decreased reflex, so it would be graded from 0 to 1. And if a lesion involves the cerebral cortex, the brainstem, or the descending motor tracts, they are considered an upper motor neuron, which is UMN, and these lesions would result in an increased reflex graded from 3 to 4. So under normal circumstances, this monosynaptic reflex is an inducible action, but it could be a pathology. So in patients that present an abnormal deep tendon reflexes, it could be because of a variety of issues. So when they do these tests, it provides an insight towards the underlying neurological dysfunction that could indicate a wide variety of etiologies, ranging from spinal cord lesion to even dehydration or an electrolyte imbalance. So identifying or determining the cause of these abnormal reflexes could involve like lots of different professional healthcare workers, and it helps a lot to figure these out so they can find treatment strategies or manage these patient's care. And of course, a reflex is an involuntary, nearly instantaneous movement. Like when you fall, your hands catch your fall or break your fall, or when something is hot, you pull away. But these reflexes obviously do slow down with age. Physical change in nerve fibers slow the speed of conduction, and these parts of the brain involved in motor control lose cells over time. But the effect of age on reflexes and reaction time varies obviously from patient to patient or from person to person. And you can slow these down or even reverse the effects of aging by physically staying active or by doing regular exercise. For instance, like a sports like table tennis may be played with rapid reflexes due to the small playing area and the size of the ball, or exercising regularly is also linked to faster reflexes because of increased blood flow and oxygen. So basically, to help aging or slow down the effects of aging with reflexes, training is the best way, or staying physically active is the best way to train your body to perform the response that you want to happen. That's just a little side note. And then here are references. Questions?
Let the reference, please.
Oh, sorry.
Okay, questions? Okay. Okay, very good. Questions? No questions? Okay, I have one question. Since your point of view, that you are the expert in this, which will be worse? Hypo or hyperreflexia?
In our opinion,
Yeah.
I mean, in my opinion, I would say hyper, just because
Hyper or hyper?
Hyper, because you would be responding to everything immensely, but that's just my opinion.
And I think the opposite, maybe no response is worse.
That's good. That's an equilibrium between the two presenters. It's an equilibrium, okay? Yeah, continue.
Yeah, I think no response, so hyporeflexia. Imagine not responding to stimuli.
You are more dangerous
Yeah,
If
like
you
if
do not
you just touch a
respond,
hot stove,
if you
burn
don't
your
respond
nail.
quickly to uh, some stimulus, it could be worse. It's also my point of view.
Yeah.
Okay, both reflects a disorder, of course, in the person, our patient. But see, my point of view, the hypo is going to be worse because it's slow your response, and sometimes we need a fast response to certain circumstance, okay, or certain stimulus.
Yes.
Are you agree with that?
I agree.
For example, you have something that is burning, and if you are going to touch that is burning, and you don't have a quickly response, probably you can burn yourself.
Yes.
Or you are conducting a car and you need a reflex. If it's not a fast reflex that you have, probably you have an accident. That's my point of view also. Okay?
Yes.
Okay, very good. Excellent. And that's why, in order to, as you mentioned, and you show the one of the activity that is recommended to maintain your reflexing order, the ping pong. That's why I'm pretty good with the ping pong. I buy a ping pong table for my grandchild, but I also practice with them.
That's
I
good.
have a home this. I have a home this. I have a pool. I have a basketball, and I have a football net also. So this is a sport place to play whatever you want in a small house. Okay, very good,
Thank
excellent.
you.